When food is ingested, it travels along the digestive tract, where it is broken down into its component nutrients in order to be absorbed into the bloodstream. One such nutrient is glucose, a simple sugar. Glucose gets absorbed by the intestines and then enters the bloodstream. It travels through the circulation to all body cells. Once absorbed into the bloodstream, glucose circulates, causing the blood sugar level to rise. An increased level of blood sugar sends a signal to the pancreatic beta cells, which respond by secreting the hormone insulin into the circulation. Insulin is necessary for glucose to reach and be used by several important target tissues throughout the body. These include the liver, muscle, and adipose tissue. Insulin is necessary to keep blood glucose levels stable in the body. Glucose enters the cell through a process called facilitated diffusion.
Diabetes refers to a group of conditions characterized by a high level of blood glucose, commonly referred to as blood sugar. Too much sugar in the blood can cause serious, sometimes life-threatening health problems. There are two types of chronic diabetic conditions: type 1 diabetes and type 2 diabetes. Pregnant women may acquire a transient form of the disease called gestational diabetes, which usually resolves after the birth of the baby. Prediabetes is when the blood sugar level is at the borderline, higher than normal, but lower than in diabetics. Prediabetes may or may not progress to diabetes. During food digestion, carbohydrates, or carbs, break down into glucose, which is carried by the bloodstream to various organs of the body. Insulin is a hormone produced by beta cells of the pancreas and is necessary for glucose intake by target cells. In healthy people, beta cells of the pancreas produce insulin. Insulin binds to its receptors on target cells and induces glucose intake. In type 1 diabetes, beta cells of the pancreas are destroyed by the immune system by mistake. The reason why this happens is unclear, but genetic factors are believed to play a major role. Insulin production is reduced. Less insulin binds to its receptor on target cells. Less glucose is taken into the cells. More glucose stays in the blood. Type 1 is characterized by early onset. Symptoms commonly start suddenly and before the age of 20. Type 1 diabetes is normally managed with insulin injection. Type 1 diabetics are therefore insulin dependent. In type 2 diabetes, the pancreas produces enough insulin, but something goes wrong either with receptor binding or insulin signaling inside the target cells. The cells are not responsive to insulin and therefore cannot import glucose. Glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Here again, genetic factors predispose susceptibility to the disease, but it is believed that lifestyle plays a very important role in type 2. Typically, obesity, inactive lifestyle, and unhealthy diet are associated with higher risk of type 2 diabetes. Type 2 is characterized by adult onset. Symptoms usually appear gradually and start after the age of 30. Type 2 diabetes accounts for about 80 to 90% of all diabetics. Management focuses on weight loss and includes a low-carb diet.
A1C test is a blood test used to diagnose diabetes and monitor the progress of a treatment plan. The test result reflects the average blood sugar levels in the past 3 months. A normal blood glucose level corresponds to an A1C result of less than 5.7%. An A1C level higher than 6.5% indicates diabetes. Between 5.7 and 6.5% is pre-diabetes. For most diabetics, the goal is to bring A1C level down to 7% or less. However, patients' age and other health conditions must be taken into account when setting goals. In general, younger patients who don't often experience severe low glucose, known as hypoglycemia, need lower goals to avoid diabetes complications in the many years ahead. Older patients or those having frequent low glucose episodes may have a higher goal. It is important to note
You
that
or someone you know may have been diagnosed with diabetes. This video will show you what it is and why it's important to keep it under control. People can have different symptoms with diabetes. Common symptoms include feeling very hungry, feeling very thirsty, urinating often, fatigue, blurry vision, and slow healing of wounds. People with type 1 diabetes may also experience weight loss. Symptoms of type 1 diabetes usually develop suddenly. They may make a person feel very ill. On the other hand, symptoms of type 2 diabetes usually develop slowly. They may be mild enough so they are hard to notice. Some people have no symptoms. If your high blood sugar level isn't treated, life-threatening complications can result. For example, you can become severely ill with a condition called diabetic ketoacidosis. It's more common in people with type 1 diabetes. Here's how it happens. Because you have little or no insulin in your blood, your cells can't get the sugar they need for energy. As a result, your body turns to fats and proteins for energy. As your body breaks down the fats, certain substances, known as ketone bodies, build up in your blood. This results in a condition called ketosis. If ketones build up to dangerously high levels in your blood, you may develop diabetic ketoacidosis, or DKA. This may result in coma or death. If your blood sugar level drops too low, you may experience a serious complication of diabetes called hypoglycemia. A common way this can happen is by taking too much diabetic medication or not eating. Too much insulin or oral diabetic medication can cause too much sugar to go into your cells. Then your blood sugar level drops down too low. Certain organs, such as the brain, need a constant energy supply to work properly. Because the brain's main source of energy is sugar, it's the first organ affected by lower sugar levels. When your brain cells, called neurons, don't get enough sugar, they start to malfunction. Symptoms such as nervousness, shakiness, and confusion can result. If your blood sugar keeps dropping, your brain does not have enough energy to work properly. This can result in seizures or diabetic coma. If your blood sugar level remains high over time, long-term health problems can occur. They include heart and blood vessel disease, stroke, blindness, nerve damage, kidney disease, and amputation of a foot or leg. If you have questions about diabetes or the medications for it, speak with your doctor. It is important to take your medications as directed by your doctor. Tell him or her about any side effects you...
Hypoglycemic drugs are medications used to lower blood glucose in type 2 diabetic patients. Dietary glucose absorbed from the intestine passes by the liver before entering the general circulation. The liver controls glucose output to the blood by converting excess glucose into glycogen for storage. During a fast, glycogen is converted back to glucose to be released to the blood. Two major pancreatic hormones are involved, insulin and glucagon. Insulin is secreted in response to high blood glucose levels, such as after a meal. Insulin enables body tissues to uptake glucose, thus removing it from the bloodstream. Insulin also stimulates conversion of glucose into glycogen and fatty acids. On the other hand, low blood glucose levels induce glucagon release. Glucagon acts on the liver to promote conversion of glycogen back to glucose, as well as de novo glucose synthesis. While type 1 diabetes is caused by a low insulin production and can be effectively managed with insulin injections, treatment of type 2 diabetes is more complex. By definition, type 2 diabetic patients have a normal insulin level, but their tissues are not responsive to insulin. However, with time, some patients may also start losing insulin production. Hypoglycemic medications may promote insulin production, increase insulin responsiveness, decrease hepatic glucose output, reduce dietary glucose absorption, or increase glucose excretion in urine.